We are ASRI, a rainforest conservation organization in Indonesian Borneo. But we do more than plant trees. Everyone around the world needs the rainforest to survive. It gives us water and clean air to stay healthy. But our forests in Borneo are disappearing faster than any other place in the world.
Gunung Palung is an incredibly precious and important rainforest. It is probably the most diverse rainforest in Indonesia and one of the most diverse in the world.
Illegal logging in the Gunung Palung National Park is a big problem for our community. Many people don't have options, so they cut down trees to sell timber to provide for their families.
One of the assumptions that a lot of people make from the outside is that local communities are cutting down the rainforest because they don't care and they are just looking to eat, right? That's actually not true. They care about it.
In 2007, we went to the villages and asked, what would you need in order to be able to protect this precious rainforest?
One of the major drivers of deforestation, of destroying the rainforest, where we work around Gunung Palung National Park, was actually the need to pay for healthcare. When we were able to offer affordable, high-quality healthcare, it just transformed things.
Clinic ASRI is our local medical clinic that provides incentivized healthcare to the people of our village.
We give higher discount to a village who has no illegal logging. Patients can also pay with non-cash payment, like pay with manures or with baskets or with many other handicraft.
Many of ASRI's patients pay for healthcare in seedlings. These seedlings are planted at 2 different reforestation sites developed by the ASRI team. Holistic care is hard to find in our region, but ASRI's well-trained medical staff provide a high level of healthcare.
They're coming to ASRI from around 5 hours away, and then sometimes from the island. They need to take a boat, and then they need to take a bus, then find a way to come to ASRI. They're traveling that far to come to ASRI, I think, because they know we will take a good care of them and they won't get disappointed.
Along with incentivized quality healthcare, we also provide alternative jobs for loggers in the reforestation sites.
Semenjak saya kerja di ASRI ini, membersihkannya, menengok kayu yang pohonnya jangak itu saya tidak ingin akan membunuh, Pak. Sayang gitu. Mendulunya lah, pokok saya nengok kayu itu habis.
Radically listening to our communities had a great impact from the beginning. And we kept listening to the needs of our people and created more programs. These programs include sustainable farming, after-school programs in conservation education, and livestock management for widows in our community. ASRI receives funding from generous donors from all over the world. But we make sure ASRI functions at the local level with constant community input and an almost inclusively Indonesian executive team.
If we own something, then we will take care of it more. It gives confidence also to the Indonesian, and also it's much more acceptable also with the local. It's more contextual to have an Indonesian leader. It's easily for them to talk deeply, like from heart to heart.
We see ASRI as a holistic win-win solution that meets the needs in our community and protects this critical ecosystem.
Kita bisa merawat hutan, bisa bertemu dengan kawan-kawan, bisa kenalan dengan ASRI, dan kita cukup sangat senang di sini. Bisa merawat hutan di sekitar kita. Kita jadi penyinso, tidak jadi penyinso lagi. Cukup lumayan kita di sini.
We are ASRI, and we save the rainforest with a status quo.